Okay, so I am going to do a video lecture over chapter 29. It's the growth and development of the adolescent. Please watch this video entirely. I first want to get this screen shared. We will be posting all 3 chapters to your Canvas site so that you guys will have access to those. And then on Thursday, when we're in class, we will go over each chapter per campus and kind of just highlight some of those main facts and things that you need to do. We may even do some activities, things like that to just make sure that we've got that information down. So let me share my screen to you guys. We will share screen. So this is the growth and development. And then I'll let you guys see me just a little bit more here, just like that. So this is the growth and development of the adolescent stages. So we know that there are 3 different stages of adolescence. There's an early stage, and that's about approximately 11 to 13 years of age. We also have our middle adolescent stage, which is between 14 and 18 years old. And then there is a late adolescent stage that runs around 19 years to 21 years old. So we're going to kind of focus on the growth and development during this time, not so much in the later aspects, but I will touch on that. One of the things about growth and development, look, I added pictures of my daughter. This was her first day of kindergarten, and then this was Brecken on her first day of her senior year. So as you can tell, there's a rapid physical growth that happens during this time. That is only second to kind of that rapid growth in infancy. So they have this burst of growth when they're infants, and then as they become adolescents, they kind of have this second rapid growth during their adolescence times. So one of the things that happens is their proportions change. We can kind of see that pot belly here of that preschooler, preschooler age, where they kind of have that little pot belly. A lot of their body fat is kind of stored in this middle area here. Their facial features are not as defined. They still kind of have that baby face, those round cheeks. But as you can tell, as you grow in that stage, you start looking mature. You look like an adult. A lot of times our females are pretty much fully developed, and so are our males during that time when we get to the later adolescent stage. So what happens is our sexual characteristics and reproduction starts to occur. So we start getting the estrogens and the testosterones, and then that is kind of what jump starts that growth. We know that girls should stop growing between 2 and 2.5 years after the onset of their menses or menarche. Remember that menarche is just a fancy word for the start of their period. And then boys will stop growing probably about 18 to 20 years of age, or so they really grow a lot longer. They take a little bit more time to kind of get fully developed. But as we can see, we can start seeing those sexual characteristics, and we know that they're starting to mature as far as in their reproductive organs. So sexual puberty, it's about 9 to 10 years of old. That's when it starts. They'll get what's called tenarche, which is the growth development in their breasts. And then the boys will begin at 10 to 11 years old. So they'll start that process during that time. So you're going to start seeing some of those hormonal changes, and then start seeing some of the beginning stages of that burst of growth during this time. We do know that the cognitive and emotional development is very dramatic during this time. Their brain is developing. It's kind of doing a reset at this point. It's starting to develop those myelin sheaths and forming those healthy myelin sheaths so that those neurons are able to connect and communicate faster. They are starting to kind of refine their brain a little bit. So a lot of that cognition and emotions can be really high. You know, it's interesting because they say that the teenage years is just, oh, it's so dramatic. These guys are, you know, their hormones are raging, they're unstable, they get in trouble, they're rebellious, but really it's just their brain kind of rewiring itself to kind of dump all of that other information that they don't need and don't use when they were, you know, using their brains as a sponge in their childhood stages. So they're kind of sifting through everything and filing it off and getting rid of some of the information that's really not needed to kind of help refine who they are. So with that being said, adolescents, they try to have this identity formation, and we'll talk about Erickson's stage of development here later on in the slideshow. So in all reality, it's not really that they're chaotic, it's just that they're learning who they are, and they're learning what they love and learning what they want to do. So, but this is kind of part of that growth and development cycle. So here are the list of physical changes related to puberty. We know that in those early years, that's when for females, we see that soft pubic hair forming. They start getting those breast buds, that's called tenarche. Their menses will soon begin, and then they'll have an increased pigmentation in their genital area. This is all normal. We need to make sure that when we're talking to children that are around this age, that we let them know what normal patterns are. For our males, pubic hair begins and it spreads laterally. So they'll start getting some pubic hair, you know, in their midline, on their stomach, on their chest. They'll even have start beginning to get facial hair. And then of course they'll have the underarm hair and then the pubic hair as well. The scrotum and the testicles start to enlarge during this time, as well as the penis. The scrotum will also begin to darken during this area. That's just due to those increased hormonal levels of testosterone. In the middle years, is about 14 to 16 years old, they'll start having coarser pubic hair. They will kind of have a more wider distribution of the pubic hair in both the males and the females. And then our areolas as females start to begin to darken and enlarge, and they get more prominent. It looks like a more common areola that we see in women. When we have our males in this age, they might start to have that soft facial hair will start being soft, but then as they age and as they have an increase in testosterone, it'll begin to get a little bit more coarse. They will have penis widening, the glans penis starts to develop more fully, and then that's when we kind of see an increase in the size. In the late 17 to 20 years old age for females, they will start getting adult-like pubic hair and breasts. So that's when they actually fully formed as far as their reproductive changes. The men tend to, or the boys during this time, this is really when they start looking like men. I have a lot of female friends that have sons that are this age, and they're like, oh my gosh, I just look and I just see my husband, they're just fully formed. Now we have to remember that just because they have these characteristics, they are still children, especially at 16, 17 years of age. They're not quite to that adulthood yet. So that's oftentimes hard to forget. Other physical changes in adolescence, they do include some voice deepening, both in females and in males. Of course, it's most dramatic in the males. During that early to middle stages of adolescence, when their vocal cords are starting to mature, you'll kind of have that squeaking voice, and those guys will kind of have that weird shift, the weird change in there, and they're really self-conscious about it. So you have to be really careful not to kind of mention it or point it out. We do not want to make these kids too self-conscious about themselves. Their limbs are also going to elongate. They're going to look very leggy. I know you might even hear the term lanky. They may have a little bit of decreased coordination in that beginning areas as their growth plates start to grow and the ends of their long bones start to close. So they're going to be a little bit uncoordinated as they kind of go back to those toddler years when they're learning how to walk again. They may have a little bit more uncoordination until those bones can mature a little bit more. They will definitely start getting some of their mature sweat glands. Those apocrine glands will start activating in the axilla area. For the girls, maybe under their breasts and even in their genital areas. So hygiene is super important. You're going to start having that smell that you smell when you walk into the room, and it's like, oh my gosh, it smells like a gym in here. So their skin changes also during this time. We do know, I think everybody knows, and everybody has struggled with acne during this period of hormonal changes. So we have increased sebaceous gland secretions within our pores of our face, and a lot of acne forms at this time. They're still learning how to properly care for their face and their skin. So it's super duper important to make sure that you're educating your patients on this age of how to care for their skin and what they need to do for their skin types. They will have an increase in body hair. So of course, our girls, our adolescent females, are going to get really curious about using that razor and starting to shave their legs. And so you need to be really careful about how you educate, and maybe educate the parents on, with my daughter, I was like, you are absolutely cannot use a razor, just because I didn't want her to cut herself. So we used a Nair. We used just a hair removal cream on her legs until she was probably about 15 years old. She actually preferred it later on in life too. So there's other ways to remove that hair for the girls and still be safe. What happens as far as the physical changes for our females and our males, not only sexually, but you'll see a hip widening in the females. Their hips are just widening and preparing themselves for that's that onset of menses. So once we start menses, they can start carrying babies. We don't want them to during this age, but our hips start widening, and then that way they can house a child eventually. With the men or the boys, we start seeing a widening of the shoulders, and they start getting that more of a V shape instead of that straight down tree shape that is so familiar in those younger teen years. So you'll start seeing those really massive wide shoulders that start to occur. When we are, one of the other things with the males is you're going to see basically a weight gain. You might even see an increase in muscle mass. And of course, their body hair is still kind of growing. So they'll have that chest hair, and the leg hair is real coarse. And then they'll have that facial hair that occurs. Physiologic changes in adolescence. So we know that that secretion of estrogen in the girls, and then the testosterone increases in boys, stimulates those physical sexual changes. So that's what happens. That's what occurs. So they will have hormonal changes, and of course they're going to start becoming a little bit more sexually mature during puberty. This is important to know. The peak height for girls is about 12 to 13 years old. So girls are usually at their maximum height by the time that they reach about 13 years of age. And it's usually 14 to 15 in boys. However, I have seen boys kind of have this growth spurt, as they're 16 and 17 years old. So this poses a lot of challenges for boys. When you're 12 years old, you think about boys versus girls, and you've got your friend groups. A lot of times girls will end up much taller, much more mature looking than the boys will in their same class. So that can kind of pose a little bit of a kind of an insecurity for our male patients. So you just need to make sure that you're educating those both females and boys, and let them know you are going to grow, I promise. That girl that sits in front of you is not going to be taller than you for the rest of your life. What happens with the muscle mass for the boys, the girls will also have an increase in their fat deposits, and those fat deposits occur around the hip area, in the breast tissue themselves, in the buttocks and the rear. So they're just really starting to get their figure and a little bit more of those curves. That's very normal too. A lot of girls, especially young girls, are very, very self-conscious about that too. We don't want to give them any kind of disturbed body images. Organ system maturation. So we talked about brain development just a little bit ago. I talked about that myelin sheath is becoming to be a little bit more healthy. It enables that faster neural processing, and then what it allows is a better cognitive growth. So basically these kiddos can start realizing, what it is that they like, what it is that they love, and then they can start fine-tuning those things that they like to do, they love to do, things that they're interested in, and kind of have this increase in ability. So their reaction time is much better, their coordination is better. This is why we start learning how to drive. They have better hand-eye coordination. So this is kind of that neurological system that's maturing. The respiratory system starts beginning to look like an adult's, so they increase their diameter. Of course, their respiratory volume increases, and so does their vital capacity. As far as their cardiovascular system, the size and the strength of the heart increases. The systolic blood pressure starts increasing to those normal adult levels that we learned in fundamentals, and then their heart rate will start to decrease, because remember, in those childhood stages, about 100 is okay all the time. We're going to start slowly seeing a decrease to where it's back to that 60 to 100 beats per minute range. One of the key things is during this childhood stage or adolescent stage, it's very, very important to do a full physical assessment. So a lot of times cardiac issues are found in a physical assessment that's done, either a heart murmur or some differences in their heart rates and their heart rhythms, and they can have some serious complications with their cardiovascular system during this age. So that's why before they go into doing sports and participating in any kind of sporting activities, they really need to have a full physical assessment to make sure that they're healthy enough. There's been a lot of just unannounced deaths that have occurred of cardiovascular things that have been missed. So it's super important that we pay attention to those things, even though they're adolescents and we don't expect them to have any heart trouble. With our GI system, they will finally have their permanent teeth. They may even start having braces during this time. That could pose some nutritional challenges later on, but they'll have their permanent teeth by this time, so no more losing the teeth. They are still awaiting their wisdom teeth at this point, which don't pop up until after about 20 years of age. Their liver, spleen, kidneys, and all of their digestive tract really start to mature and are at or about adult size during this time. their musculoskeletal system, it grows in a linear growth pattern, and it's not complete until late adolescence in boys, and then a little bit earlier in girls. So we know that we remember in anatomy and physiology that we have these growth plates that are in the bones that allow our bones to elongate and grow. So our bone actually grows at that growth plate level. So when you have adolescents and children and early adolescents and then later adolescents as they're in sports, sporting injuries and any kind of bone fractures or anything like that that's close to that growth plate, we've got to pay attention to that because it can actually affect the growth of that bone during this time frame before their bones can fully mature. So adult height is obtained whenever those growth plates are no longer growing anymore. They've closed and they're usually in late adolescence, so about 17, 18, 19 years of age. Our integumentary system, so that's our skin. Our skin is very thick. When we're teenagers, it's very tough. So we have highly active sebaceous glands. So we have our sweat glands that are forming and are very stinky and smelly. And of course, I mentioned problems such as skin issues, acne, facial acne, cystic acne, different things like that are likely to occur during this stage. Okay, so let's talk about that developmental theories really quick. So we know we use Erikson more often in nursing school, but do not forget about Piaget. So let's talk about Erikson first. So Erikson is identity versus role confusion or diffusion. So basically they are starting to develop their own personal identity and they get really confused or can get very confused during this time of who am I? Who do I want to be? Who do I want to hang out with? What choices are the choices that I'm going to be making? So they're able to, it's what happens because of that identity crisis that could occur or that identity development that they're trying to learn is that they focus on their body changes. So remember earlier, as I'm talking about, we need to educate them on what's normal so that they know that they're not different from their peers, because that's a huge aspect of who they are in their own identity. So their peer culture is highly important to them. As a matter of fact, peers are much more higher priority over their family. So us as parents who have had our children in their teenage and adolescent years, we need to not feel so butthurt about our children, our adolescents choosing their friends over their family during that time, because it is pretty primary that they have that peer support. So with Piaget, it's called, his stage is called formal operation. So at this time, they have a growing capacity for abstract thought. They're pretty much mostly interested in just the present. What is going on today? What is going on this week? And they're really not as concerned about the future yet. So as you have a 15, 16-year-old daughter or son, and you're asking them, well, what do you want to be? You really need to start thinking about what it is that you want to be. They're not there to think about the future just yet. They're not there. So when they respond with, I don't know, that's a normal response. They're only thinking about the here and now. However, their intellectual interests will start to expand, and it's going to start becoming a lot more important. So school is highly important for these kiddos, active in learning and having good teachers that kind of support that learning. They will start having a deeper moral thinking. So they're going to know at this point what is right and what is wrong, but they don't always follow it due to the risky behaviors that brain just naturally wants to do. They will have more capacity for starting to set goals at this time. And then they're going to start beginning about 16, 17 years of age. They're going to start thinking more about the meaning of life. It's like, why am I here? What am I here for? What does it mean to live? I know my daughter was like, I want to travel the world and I want to see all of these things. And I'm like, yes, do it. Please do it. Live and try to find a deeper meaning of your life and where you fit into this world during this time. They will, at late adolescence, so not until about 19, 20, 21, they're going to fully be able to think ideas through. So they're going to come up with a thought process, and then they're going to be able to carry out those ideas during that time. They will also be able to, by this point, hopefully, is delay the gratification. Okay. It's no longer an instant gratification type thing. They can delay some of that and just kind of move forward. So they're a lot more patient during this age. They will start becoming, during that early and the middle adolescence, when I said they're only here for the here and now and the present, and they're not really thinking about the future. By late adolescence, they will be starting to think about what it is that they want in life, and they'll have a greater concern for future. So that is kind of where we stand as far as those developmental theories. Very, very important that you recognize that Erickson's is the identity versus role confusion. Okay, ways to communicate with your teen. So I thought I'd put some throwback pictures of me when I was about 16 years old, because I know it was difficult to communicate to me during that time. I have some of my peer group friends here, but it's really important for us as a nurse to know how to communicate to these folks. We want them to be able to trust us, and we want them to be able to tell us what's going on with them. It's super important during this time. So some of the things that we can do and we can educate parents on is we need to allow sufficient time for conversations. So that's like planning out at least a half an hour where it's just you and the teenager sitting down and having a conversation. Okay, so take time to talk. Don't just think that a 5-minute long conversation is going to just have a highly philosophical, and you're going to be able to pull all this information out from your teen. So allow time for that. You always want to speak respectfully to the teenager. You don't want to talk down to them. You don't want to speak to them as if they're still a child. I know they are still a child, but you need to start learning how to have mature conversations and speak to them in a linear way and not down to them. You do want to talk face to face and really pay attention to different body language as certain subjects come up. You want to make sure that your own body language is appropriate as well. You don't want them to automatically become defensive, because they will if they sense that you're angry or upset, or you're kind of like trying to hover over them. They're going to be able to recognize that, and their immediate response is going to be defensive. We always ask open-ended questions for all of our patients, and we do that so that we can clarify our understanding of what it is that the patient is saying. We also want to do a reflect back, or a read back, or a talk back, where we just clearly restate what it is what they were saying, so that they can hear that and make sure that they were making the message clear as well. So it not only allows us to fully understand, but it kind of allows the teenager to be like, oh, that's what I said. And then it's clear and concise. So we want to make sure that we choose our words carefully whenever we're speaking. Of course, their vocabulary knowledge is ever increasing at this point. So they should be able to understand complex terms at this point. But we do want to make sure that whatever message we're trying to tell them, we want to make sure that it's clear and intentful and it's consistent. We also want to be honest with them. So we sometimes don't know the answer to the questions. I don't know the answer to the questions as you guys are talking to me and asking me questions. Sometimes I don't know. I don't know what that is, but I'll find out. So you always want to have that honesty with them. You want them to be able to trust you. So if they ask you a question, ask you something about themselves or ask you something about a certain situation, you do want to kind of give them that information in an honest way. We always want to do that praise. We want to make sure that we're always giving them praise. We're boosting up that self-confidence. In the hospital setting, it's super duper important for us to be able to include the teenager in their decision on what it is that we're going to do as often as possible. Of course, until they're 18, they are still under the care of their parent, but we still need to be talking to them and saying, you know, this is what needs to happen. You need to have this surgery. Do you understand the surgery? And does that sound like a good plan for you? And then allow time for that parent and that patient to talk freely about that decision that needs to be made. But we do want to make sure that we have the teens' input, including their fears or anxieties or anything that may, be scary for them. We always want to clearly state your expectations and you set limits. So as a caregiver, as a nurse or as a parent of an adolescent teenager, you need to make sure that you've set your own boundaries too. And they need to know what those boundaries are so that they don't run over those boundaries that you've set for them. It's super important with every assessment and every time that we're communicating to patients, especially in that adolescent time frame, we need to offer privacy. So it is okay, and we should be asking the client, do you want your parents here while we're discussing this? So yes, that is a perfect time for us to offer that privacy for them. And we need to be doing that regularly in a hospital setting and not just be freely talking about things in front of their parents. Of course, anything that could be harmful to the patient themselves or something that their parents need to know, it is our obligation to make sure that that family member is aware, the caregiver is aware, and then also the provider. All right, the influence of peers during adolescence. I thought this was a perfect way for me to kind of show you guys. This was me and my friend group when I was about 17 years old. And then here was that same friend group that we're still very close with in about early 2020. So we have a huge, during this time, we have a huge impact on our peers, and our peers have a huge impact on us and how we end up in life. So it's super important that we remember that. So of course, who you are around kind of helps shape you in those late adolescence and early adulthood years. We have, I just thought this was funny to kind of show you that there's a huge influence of peers during adolescence. So play is an essential role in the identity of the adolescents. So we know that there is a lot of social emotional developments that occur, and there's some dilemmas. So these kids will start kind of having a sense of struggle with their own identity. They're going to feel awkward about their own body, and they're going to worry about not being normal. They're going to know at this point that our parents are not perfect. It's like when Brecken was, 7, she thought I was the cat's meow, but when she was 15, I was a demon. So they are realizing that we are human too, and we're not superhuman as parents. So there's going to be a big increase in the conflict with the parents. They're starting to realize, who am I outside of my family? Who am I outside of my family? They are going to put high expectations on themselves and kind of have poor self-concept. They're going to continuously have to adjust to their body changes, and they're still going to worry about being normal. They are driven to make friends, and they have a much greater reliance on their friend groups. And popularity is super important for most kids this age. So they want to be the who's who. They want to be active in who they see as popular within their school system. So it has a high prevalence for these kiddos. They are starting to get that puppy love, and they're starting to feel that love and passion for somebody. So this is the time whenever those relations start. So we really need to, as parents or as nurses, or if you're a school nurse, you need to make sure that the place that they are spending the most amount of time allows for good recreation, that these kids have made companions, and that they have somebody basically that they can share their problems with and also share their successes with too. So it needs to kind of be a positive environment for them. So we need to obviously create stability in times of stress or transition. I know with my divorce, my daughter was 17 whenever I told her that I was getting a divorce. And I think that it affected her more than it did my 6-year-old and 8-year-old at the time. And I didn't realize that. I was so focused on the younger kids and making sure that they knew that there was a stability, that I kind of lost focus on my 17, 18-year-old, because I thought, she's 17, 18, she should understand by this point. But not by that kind of transition that occurred for her. It made it really difficult, and we had to work on some things. We need to be credible sources of information. So whatever information that we are giving to them, it doesn't need to be our opinion. It needs to be credible. It needs to be concise. We need to give them information that's honest and truthful. And we have to make sure that we kind of reinforce those social behaviors that occur during this age, what's right and what's wrong, and kind of help them with their moral development. We know that our peers will have positive and negative or negative influences. Even one peer might have a positive influence during a certain time, and then so-and-so made out with so-and-so, or they were boyfriends with so-and-so and stole this boyfriend, and then all of a sudden there's bullying now, and it can turn negative. So we need to make sure that we're being supportive in that during those times, because it can really be devastating to lose friendships during this age. So let's talk about safety concerns for adolescents. So there's a lot of unintentional injuries that can occur. Those unintentional injuries are really them just kind of being risky, and those risky behaviors, like I'm going to show off in front of this group of friends and I'm going to jump off the back of the bleachers, or I'm going to, stand on top of this moving vehicle, or whatever it is. They will have a lot more unintentional injuries during this time, even as they're playing sports. Internet safety is super important. There's some resources on Canvas that we can talk about as far as internet safety and what we need to do to kind of help foster that. Online bullying is a thing. I saw it, I witnessed it. It was painful to watch. I'm just so grateful that I did not have the internet when I was growing up in this day and age. That's all I'm going to say there. Motor vehicle safety, it's super important that you make sure that you're educating these teenagers to wear their seatbelt, make sure that they are not driving under the influence or driving with somebody under the influence, and that they remain as distracted free as possible. So putting the cell phone away, or disabling their phone as they're driving, or not having the music too loud and singing at the top of their lungs and keeping their eyes off the road, or just being goofy in general. They tend to consider a car or a vehicle as a toy, because it's fun and it's a privilege though, and not a right. We need to educate on avoiding any kind of substance abuse during this time. It's a high incidence of trying things out. Going to their first parties, going to their first social events where some of these things might be available to them. So you need to make sure that you're educating them and giving them good, valid resources on what happens when you take these types of drugs. Firearm safety is super important. You need to make sure that you continue to lock up your firearms. I know that there's a lot of school shootings that occur, and it's during the adolescent years that oftentimes the school shooter is in. So keep your firearms safe, keep them locked up, make sure that your children and your teenagers do not have access to those. And then of course, water safety too. So if they're, we have these little rock quarries over kind of down here in Altus where, I had a friend, he was in his 20s at this point, but, they were jumping off the rocks and into the water, and he ended up being paralyzed from the waist or from the neck down. So that's kind of that water safety that we need to kind of talk about. So just to make sure that they're safe and aware in those type of situations. So let's talk about factors that influence the adolescent diet now. So we know that with all of these growth of muscles for our teenage boys, and then the increase in development of that body fat in the breast and in the hip areas, there is a lot of peer pressure on what it is that these students eat. So I know I always made my daughter until, well, all through high school, junior high, I was like, you're getting school lunches. And she was like, well, I don't like the school lunches. Well, then I didn't want her to not eat. So I was just like, okay, well, you pack your own lunch and you eat your own lunch. So whatever it is that you need, because they have this peer pressure of, ooh, it's so gross to eat in the cafeteria. Ooh, it's so gross. And you kind of see that, and it's really not, it's just their opinion or somebody else's opinion. And then they kind of attach to that. So a lot of times these kids are those vending machine diets where, whatever's the cheapest, they're going to eat because they want to save their money and put gas in their vehicle, or they want to save their money and buy the new outfit or the new music or the new purse or the new whatever. So a lot of times they will opt for not eating so much and maybe just going to that vending machine and grabbing a Coke and maybe a deal of donut sticks or something. I know that's what I lived off of when I was in high school, is those little Dunkin' Donut or those little donut sticks. Oh, they're so good. And you will start seeing during this time, because they're so busy with those activities that they're interested in, there's a lot of lack of time to have sit down family meals. So at any possibility whatsoever, you need to encourage sit down family meals and have a highly nutritious dinner. And not only will that help with their nutrition, but it also helped with you to kind of find time to connect and communicate with that teenager during that time. They are going to start having a higher independence for their food choices. So at this point, if I was cooking spaghetti and Brecken didn't want spaghetti, she's like, I don't want spaghetti. I'm like, okay, well, you can go get whatever you want then. So it's your choice. So she would rather make something herself, or she would go to Arby's or McDonald's or wherever she preferred to go. So, we need to make sure that when we're doing a nutritional assessment, of course, that we ask them what they eat, what types of foods that they eat, if they, how often they go to fast food joints, what kind of snacks are they using, are they drinking enough water, and then what are they drinking sodas, and then we need to make sure that they really have a true understanding of what nutrition is. I will never forget, one of my biggest pet peeves is, I would say to Brecken, well, what's your favorite vegetable? And she would say corn. Well, first of all, corn is not a vegetable. It is a grain. And so I had to kind of make sure that she knew that, what vegetables were versus what grains were versus what's healthy, what's unhealthy, what's perceived to be healthy, because there's a lot of things out there that teenagers think are healthy, but it's really not. There are ways that you can kind of say, okay, well, if you love McDonald's, let's look and see the calorie balance and some of these macronutrients or micronutrients that are in each item, and see what really is healthier that can still give you that satisfaction of ordering your Whataburger or McDonald's. So it's truly important that they stay physically active during this time. That way they can kind of balance out and even out some of the things that they're eating, those vending machine meals that they're having. Healthy weights is important. We still need to be assessing their BMI. We utilize BMI, so we take their height and their weight. And there is a BMI calculator on your Canvas site, so look for that. And we will be utilizing that tool in the assessments. Here is we use the MyPlate to help assess for nutrition for the kiddos. So here's just an example that you can find on the slideshow of what would be proper food. So if we've got an increase in muscle mass growth for our teenage boys, we need to be making sure that they're eating enough protein, because that kind of stimulates that muscle mass. So those are some things that you can educate those teenagers and adolescents for a healthy meal planning. Sexual health and adolescence. Okay, so this is a time frame when we start sexual education in schools. The sexual interest is going to be high. These guys are out to get the cutest boy or the cutest girl, and they're having crushes on a different person every week. Remember, this is their brain starting to kind of trim away all of the stuff that they've learned from their families, and they're starting to identify with what is it that I like, and what is it that I find attractive, and what is it that I want in life. So they are going to start having some sexual interest in both opposite and same-sex partners during this time. It's a part of human development, and it occurs in that adolescence time frame. So they might have curiosities between the opposite sex as well as the same sex during this time. And those are normal behaviors. So we just need to make sure that they're communicating those to us or to a trusted individual, and we're giving good information for them to use to learn more about what it is that they want. They have to learn about these new feelings. This is part of how they're going to manage them later on in adulthood. So if they have unhealthy behaviors, sexual behaviors when they're adolescents, it's going to be a high likelihood that they're going to have unhealthy behaviors in their adulthood. Conversations about sexual activity should be ongoing. My dad was a nurse, and we talked about sex from the time I was 12 years old until I was, 30. We talked about sex all the time. We talked about sex, ways to healthy ways to protect myself sexually, healthy ways to just accept my sexuality, accept who I am, how to love myself. We talked about safe sex practices. We've talked about healthy sexual relationships. I mean, we talked about those things all the time. I never once felt like I didn't have somebody to talk to. And I know it's weird because it was my dad that I was talking to and not my mom, but he was a nurse and he understood these things. It was a safe place for me to talk about when I started to become sexually active, and when, I lost my virginity and things like that. So that's going to happen during these years, more than likely. So we've just got to make sure that we're building those conversations and we're being honest so that these guys can trust us. We have to know that there are some parents that are very uncomfortable talking about this, and they're going to need support and they're going to need help. And they may even want somebody else to talk to them about child's sexual health and then themselves. But so we need to make sure that we're giving those parents enough information to give them true and honest information about this. We have to know that navigating through healthy romantic relationships during this time is a developmental task that they have to achieve in order to be healthy and happy adults. So helping them navigate through healthy boundaries, learning healthy boundaries for themselves through those romantic relationships, that's what we need to do, and we need to be able to support it and talk openly about it. Of course, teaching sexually active teens about using contraceptives is the number one importance. We need to teach them about STDs. We need to teach them about things that they could get. What are signs and symptoms? We need to make sure that they know, what it looks like, what different types of sex are, oral sex versus vaginal sex, and how that you can still get an STI or an STD during those time frames. With those healthy relationships, there are some risks that are involved with being an unhealthy relationship. So there can be, those risks are usually an imbalance of power in the relationship. So it's either a alpha female or an alpha male, and they're together and they're like talking down to the person. They're not building them, not building their partner up in self-confidence. They're not nurturing, they're not loving. They're kind of maybe even showing some violence within the relationship, or controlling behaviors within the relationship. Of course, even if you've dated your partner or been with your partner from the time you were 16 until you were 18, that's 2 years, you still need to make sure that they're not unsafe and they're not having unsafe sexual activities. So they need to be still using some contraceptives at that time, not only to prevent pregnancy, but to prevent those STIs and STDs. You're going to see, and I would most likely say 90% of you guys, as we're going into OB, there's a high likelihood that we're going to see some teenage mothers in there. So there'll be 16, 17-year-olds that are in there, that are in this adolescent stage, that are delivering babies. So we need to make sure that as we go through the OB section, we'll talk more about that, but there will be a time, and it happens all the time, that there's going to be a difficulty in that. There's going to be a lot more talk about, adoption versus abortion versus keeping the child, and maybe even being a single parent, having to be a single parent, not having 2 teenage parents would be quite difficult to manage it. Not saying that it's impossible, but it can be difficult. And then of course the dating violence that I was talking about. So sexual importance, sexual health is super, super important in these guys, in these adolescents and teenage years. I guarantee you're probably going to have a test question about that. So make sure that you cover that portion of your of that chapter, and then that way you guys can get a full understanding. I believe there's some more information on there on the Canvas site, for you guys to look through with that. So focus to encourage growth and development. So of course, sports, physical fitness, making sure that they're active and participating in school activities. We need to be specific in some of the safety issues and make sure that they get that proper education. We're also giving them proper nutrition and healthy eating habit education as well, and then set an example, kind of be an example for them. But we don't want to fat shame them. Never ever fat shame, never ever do that, because it's during this time that those young girls, young females, will start having an increase in a distortion of their body image. And when they do that, that's when they could kind of develop some unhealthy eating patterns. So we see anorexia, bulimia, fasting, maybe binging, purging, overeating, and it happens both in males and females. So we need to make sure that you're not fat shaming or body shaming, or telling a teenager that they're too overweight or they're too fat. We need to make sure that we do it in a softer way and not in a condescending way. They need sleep. Teenagers need sleep. They need adequate rest. It's okay if they sleep in on Saturdays, I promise. Personal care. They need to make sure that they are taking care of themselves as far as their hygiene, their nighttime routines, as far as washing their faces, keeping their hair clean, making sure that they're doing those personal care things for their hygiene. Sexual life, we want them to be completely healthy in that. We want to explain to them things that are normal versus what are abnormal, and then make sure that they've got all of the resources that they need, even if that is to take them to a health department or a OBGYN or their pediatrician and talk to them about sexual health. They need to have the appropriate discipline. It's not appropriate to put a 17-year-old in a corner. Okay, so we're not going to do that. They function much better when you take things away from them or not allow them to hang out with their peer groups, because remember, peer groups are very, very important. So if we tell them, okay, if you do this, here's your consequence, and then they do it, then you take away that that peer group or that peer activity, and that will make a huge impact. So make sure that the discipline is appropriate. And then mental health resources, and that'll be the last of this. So here's hygiene for adolescents. So they need to bathe regularly. They need to wash their face. They need to brush their teeth. They need to make sure that their teeth are clean. They get a lot of buildup during this time. We want to make sure that they realize that the first thing that you see is your teeth when anybody looks at you. And if you tell them that and teach them that, they will take care of their teeth and make sure their teeth are nice and white and clean and straight. We want to make sure that they're not squeezing at the zits. It's the Dr. Pimple Popper, all those videos. They love picking at their face. So we need to make sure that we educate them on how dirty our hands are so that they know not to touch their face, not to pick at their face. A lot of times these kids will start getting maybe some body piercings, some tattoos. So we need to make sure that we teach them proper ways to clean those areas so they don't develop MRSA, they don't develop a staph infection within those sites, or another underlying skin issue or skin problem. And then sunscreen. I know when I was 16 years old, I was terrible because I had this freedom, and at the time there weren't all of these laws about tanning bed use. I was going to a tanning bed twice a day. I would go in the morning and then I would go at night. And especially in the springtime, as prom season approached and all of these school dances were approaching and a summertime approached, that is highly risky, and you're going to increase your chances of developing skin cancer in the future. Now, when I teach my daughter, or I teach anybody that's in that adolescent age or those early adulthood ages, I always tell them, start young. The more you're in the sun, the older you're going to look when you're 40. And you don't want that. Nobody wants that. So make sure that you encourage that sunscreen use, that proper SPF for those faces. Okay, when we have a hospitalized adolescents, of course, we want to provide opportunities for them to maintain a certain type of independence. We want to give them choices. We want to make sure that they're doing things on their own, and we're not doing everything for them entirely. Yes, 100,000%, they need to participate in the decisions that are being made for them, about them, or to them. 100%. And we need to be an advocate for that. So we need to include, when we're going in there to talk to our patients, we're not just talking to the parents. We are asking that patient, does that sound good to you? Does that sound like a great idea? What is it that you want? What is it that you expect? So we need to talk to the 16-year-old, 17-year-old, 15-year-old patient and let them have an informed decision in their own care. That's their right. We want to encourage socialization with friends through the phone or emails or visits, especially when you have children that are in the hospital or adolescents that are in the hospital for an extended time frame, whether they've had an injury or they've got a diagnosis of cancer and they're inpatient over a long extended period of time. We want to encourage that some of their friends come in and that they still have that support group from their peers. We don't want to isolate them. And then we want to make sure that we're identifying any knowledge self-care deficits, which is, it happens, they don't know everything. And so we need to make sure that we as nurses recognize what they don't know so that we can give them the proper education and give them the appropriate resources. So whether it be an app, using an app on their phone, or maybe showing them a YouTube video, showing them they're not going to want to read a big thick booklet about whatever disease or diagnosis that they have. So trying to find creative ways to give them that information is super important. Keep them interested. So there's some developmental concerns for the adolescents that occur is they will have changes in their own body image. I mentioned anorexia, body dysmorphia, binging, purging. They might have unhealthy eating habits. They might start not loving themselves. They do a lot of body comparison during this time. We've got Instagram and Facebook and all of these social platforms that tell us what young girls are supposed to look like or young men are supposed to look like. And it's just not accurate. They use more filters during this time. That just increases their change in their body image themselves. Of course, they'll have different peer groups during this time. They may hop from peer group to peer group just to find a place that they feel like that they fit in. That is concerning. We want to make sure that we're fostering healthy peer groups and healthy peer relationships, and that if they're hopping around too often, that could be a sign that there's some kind of concern. Violence. A lot of times these adolescents have all of these emotional changes within their brain or in their mind, and they may not understand something. They're going to be quick to snap whenever they're angry or mad. So school fights happen a lot. And then unfortunately you have gun violence that can occur. Emotions are high whenever so-and-so's with this boy and that was supposed to be a guy I was with and this and that. So violence is likely to occur. There's going to be school fights, playground fights, right? But it increases in adolescence. Suicide is huge for this age group, and it's especially in increasing nowadays. So make sure that we're doing suicide screenings on these adolescents as they come in and give them information and really talk to them and see if we can't get them to the right person as far as who we're consulting. So get them into either a mental health practitioner, counseling, or that they have this suicide prevention lifeline that they can call if they're ever having thoughts of harming themselves. Homicide can occur. We see this a lot in gang violence because usually those gangs start forming in these adolescence years as they're trying to find their peer groups and fit in socially. Then they get kind of wrapped into a bad group of folks, and then they could be a part of some gang activity. And then of course, substance use and abuse. So they're going to be trying a lot of things. They're going to be trying marijuana. They're going to be trying LSD, drugs. They may be, alcohol's huge. They're going to be trying things, and it's highly accessible, way more accessible than we realize. So they can get it from their parents easily if their parents are substance abuse user or substance users. I mean, who hasn't? Not that I'm saying that this is right, but you take a clear vodka and you pour it out and then you just put water in it. We need to make sure that those are locked up, and we're discouraging drinking, underage smoking, vaping, and we need to discourage overall drug use, especially for this age. Their brains are at capacity as far as the size, but there's still a lot of brain development that's occurring during that time, and that can affect their personalities as an adult. So it's super important that we're discouraging substance use at this age. Risk factors for suicide, of course, here are a list of some of those things. It's super important that we're listening to what it is that these patients are saying to us. How are their behaviors? What is their body language? How are they behaving? What's going on in their home, in their family? Have they had any previous attempts of suicide? What's their school performance look like? Were they a high performer and then suddenly they've started drifting off? Are they starting to kind of detach themselves from some of their peer groups that they've had for a very long time, and they're isolating themselves from the people that they love or that they have loved in the past? One of the key telltale signs is they'll start giving away things. They may start giving away some personal items. A lot of times they'll even write down what their plan is. If they are either a texter or they'll do it via text through a social media platform, or they'll write it down in a personal journal or a notebook. So we need to make sure that we're seeing what those risk factors are so that we can educate parents and families over what to look out for when a adolescent is at risk for suicide. Of course, violence, like I said, those hormones rage. So there is a lot of factors that contribute to adolescent violence. So we just need to pay attention to those, and we need to realize what is the root of the problem, and what is it, how are we going to try to decrease that risk of violence, decrease those violent behaviors toward others, to make sure that they're not harming themselves or harming somebody else in the process. So of course, it's super important for us to be able to recognize. Remember, those guys are starting to get more muscle mass. They're starting to bow up. They're getting mad. They're getting angry. Those females are starting to fight for everybody else's attention. So some of the worst fights I've ever seen has been girl on girl fights. Oh my gosh, pulling out hair. It's definitely prevalent. So we need to make sure that we're paying attention to some of those risk factors. As far as common substances, we talked about marijuana, alcohol, nicotine, and vaping. I think that's probably the most significant one that I see. I mean, they will do it out in the parking lot now. And even though vaping legal age isn't until 21, they still can have access to it. They still have it. I know my daughter had access to it when she was 16, 17 years old. You can try to stop them as much as you can, but it's out there, and it's so common for these adolescents to see. Prescription drugs, opioids, you need to make sure that if they haven't had an injury, that you're watching how many pills they're taking. And then also, if there's a family member in the house that has had an injury, that you're keeping those prescriptions locked up or put away or hidden to where they don't have access to those. That is even like NyQuil and things like that. They will utilize those even over-the-counter drugs and abuse them. Any kind of there could be hallucinogens, whether it be mushrooms, LSD. They could also be using inhalants. So you've seen those computer inhaled sprays that you can spray to dust off. They can inhale that. It can cause a tremendous high on that for them. Of course, cocaine and crack and heroin, methamphetamine, bath salts is starting to become a little bit more prevalent too. So these guys need education on what happens to them when they're using it to their body, and then hopefully they won't use it. They're going to be around this. They will, most likely. So how do we do? We're going to teach them short and long-term effects of alcohol, tobacco, basically the effects of their school performance, their decision-making, how how it can affect their relationships with their friends, how it can affect their relationship with their family. They could have an increased risk for unintentional injuries. They can become pregnant if you're intoxicated and you blacked out, and you could possibly get raped for females or males, or you could have an unexpected pregnancy during that time. So there might be some unsafe sexual practices that could occur when you're under the influence like that. The how and why of chemical dependency and how chemical dependency works. They need to know the reasons why. We need to give them good, solid information about each of these drugs so that they could be aware of what they're doing to their body and what changes that they're doing for their body. We want to encourage them to maintain a healthy lifestyle and to resist peer pressure. That maybe if their peer group is peer pressuring them into doing something like that, maybe they need to reevaluate the purpose of their peer group. Maybe they need to reevaluate the type of friends that they're associating themselves with. So we want to make sure that we're also supporting that teen's own self-confidence. So whatever we can do to kind of boost their self-confidence, and that we know that we can count on them. They know morally what's right and wrong. They're starting to reason that. They're starting to sift through their brain. They're starting to make those connections. I know what's right and I know what's wrong. So we need to make sure that we're encouraging them to and saying, I know you know what's right and wrong, and you know the right and wrong thing to do in this situation. So it's a lot easier said than done, but those are some of the things that we want to be able to teach our kiddos. I want you guys to kind of look over the visual chart that I've posted in week 1. It does talk about those later adolescent years. I've got some things highlighted on there that are important. Anyways, this is the adolescent stages. I will, like I said, it'll be available on Canvas for you guys. So watch all 3 of our videos, and I hope you guys have a good day. Thank you.